Solved.
Question number 11, Katrina Shanks.
Thank you, Mr Speaker. To the Associate Minister of Health, what reports has she received on improvements to the quality and safety of the New Zealand health system?
Good question.
Mr. Speaker.
Order. Honourable Joe Goodhew.
Thank you, Mr. Speaker. Today I received the first quarterly report of DHB performance against the 4 quality and safety markers. I'm pleased at the progress made compared to the baseline data which was released in June this year. For example, 11 out of the 20 DHBs are now assessing 90% of older patients for their risk of having a fall while in hospital, and that's up from only 5 DHBs in June. 14 DHBs are now achieving at or above 70% compliance with hand hygiene practices, while the average nationally is 71%. And more DHBs than ever are using the World Health Organization Surgical Safety Checklist.
Supplementary question, Katrina Shanks.
Thank you, Mr Speaker. To the Minister, how were these deadly serious quality and safety markers selected?
Honourable Joe Goodhew.
The quality and safety markers track progress in reducing harm caused to patients in the areas of falls, healthcare-associated infections and surgery. Errors in these areas are major causes of serious adverse events in our hospitals, and there are proven interventions and practices that reduce patient harm, clearly something the opposition isn't interested in. An example of it is use of the World Health Organization Surgical Safety Checklist, a common-sense approach to ensuring the correct surgical procedure is carried out on the correct patient.
Supplementary question, Katrina Shanks.
Thank you, Mr Speaker. How do the quality and safety markers help New Zealand patients who are both mobile and not as mobile?
Honourable Joe Goodhew.
Mr Speaker, in terms of helping New Zealand patients, the use of new safety procedures has seen bloodstream infections caused by the insertion of central line catheters virtually eliminated from hospital intensive care units. Fewer infections means less time in hospital, less pain and suffering for patients, and each of them actually causes a cost to the health system of $20,000. This is indeed better, as well as being sooner and more convenient discharge.
Well done.
Point of order, Grant Robertson.
Speaker, in light of the fact that
What's the point of order?
The point of order is in light of the fact that it's Katrina Shanks' last day and probably last question on behalf of the opposition, I'd like to thank her for her contribution to Parliament and wish her well in the future.
And I thank Grant Robertson for raising that point of order and extend my best wishes to Katrina Shanks as well. Question number 12, Kevin Hay. Order. I've called Kevin Hay.
Thank you, Mr Speaker. My question is to the Prime Minister.